Hey everyone and welcome back. We're diving into a topic that is fundamental to nursing practice, human sexuality. We'll be exploring how this impacts patient care and how you can apply these concepts in your practice. This is especially relevant for our nursing students and faculty tuning in, so let's get started.
Yeah, it's interesting because when you think about it, people sometimes view sexuality as just, you know, the biological act of reproduction, but it's so much more nuanced than that.
It really is. There's a complex interplay of psychological, emotional, social, cultural factors. It's fascinating.
Right, and all of those elements impact a patient's overall health and well-being, so it really is a holistic thing.
Exactly. One of the sources we looked at actually highlighted a case study involving a middle-aged woman, Amy Liu.
Oh, yeah, I remember that one.
She was struggling with her sense of womanhood and intimacy after having a hysterectomy.
You know, that case really highlights the point that medical procedures, even when they are absolutely necessary, they can have a huge impact on a patient's self-concept, their body image, their relationships. You know, it's not just the physical aspects of care that we need to think about.
Absolutely. We need to see the whole person, not just the condition. We have to consider the entire person. Speaking of seeing the whole person, the research also emphasized how sexual identity evolves throughout life.
Right, it's a journey.
It's not static. It's a process, and every stage of life brings its own unique considerations.
Totally. The sources even discussed how variations in sexual development are sometimes there from infancy.
It's true.
And that can be challenging for families and healthcare providers as they try to make decisions and provide ongoing support.
Absolutely. It highlights the need for sensitive and informed care from the very beginning.
From day one.
And not just early development. We also need to consider the needs of people with intellectual and developmental disabilities when it comes to things like sex education and contraception.
Yes, definitely. You're right. They might need more support to make safe and informed choices about their sexual health. And we need to be aware of their potential vulnerability to abuse. It's a complex issue that nurses need to be prepared for.
It is. And, the sources also discuss how cultural factors and societal expectations play a big role in how people view and approach sex.
Oh, absolutely. Culture is a huge factor.
And sometimes those cultural practices can even be harmful. The research we looked at mentioned female genital mutilation, which is still practiced in some cultures, even though there's no medical benefit, and it can cause significant harm.
It's true. And it's a reminder that we as nurses have a responsibility to advocate against practices that can hurt our patients and promote their well-being.
Exactly. It's about being a voice for the vulnerable. Now, switching gears a bit, the sources also talked about different sexual dysfunctions that can affect men and women.
Right, like erectile dysfunction in men and painful intercourse in women. These are things that can cause a lot of distress for patients, but often go unreported because people might be embarrassed or ashamed.
Absolutely.
Yeah.
It can be really tough for them to bring up. But it's important to create a space where they feel comfortable to share these concerns.
Yes, open communication is key. We want them to know they can talk to us without judgment.
And it's not just about those specific dysfunctions. We need to remember that chronic illnesses, injuries, medications can all impact sexual health too.
Yeah, like diabetes or spinal cord injuries, those can significantly affect sexual function.
Exactly. So it's about being aware of those potential impacts and making sure our patients feel safe discussing these sensitive topics.
It's about creating that safe space. Speaking of feeling safe, the section on sexual harassment, especially in healthcare, was pretty eye-opening.
I agree. It's disheartening that it's still so prevalent.
It is, but the sources did offer some clear steps on how to confront and report harassment, which is really helpful.
That's important.
Yeah.
We need to create a culture where harassment is not tolerated at all. Everyone deserves to feel safe and respected.
Absolutely. And when we talk about feeling safe, it's not just about harassment, it's also about creating a space where patients feel comfortable opening up about their sexual health concerns.
Right. And that can be a challenge. The research highlighted a case involving a young gay man diagnosed with AIDS.
I remember that case. It was really powerful.
It really emphasized the importance of culturally competent care and making patients feel comfortable disclosing their sexual orientation and practices.
It shows that we as nurses need to be comfortable with our own sexuality so that we can approach these conversations with sensitivity and without judgment.
Absolutely. It's not about imposing our values on patients. It's about meeting them where they are and providing compassionate, individualized care.
It's about understanding and respecting everyone's individual journey.
Exactly. Now let's move on to another critical topic that was covered in the sources: contraception and family planning.
This is a big one.
It is. The sources provided a really in-depth look at all the different methods available.
There's a lot to cover there, from abstinence to barrier methods to hormonal options to sterilization procedures. It can be overwhelming.
They can. You know what I thought was fascinating? They even discussed future trends in contraception, like injectable vaccines that could potentially immunize women against pregnancy.
Wow, that's incredible. It's amazing how far contraceptive technology has come.
It really is. And it's interesting to see how the discussion around sex education is also evolving.
It is. The sources really emphasize the need for comprehensive sex education that goes beyond abstinence-only approaches.
Which I think is so important. It's about giving young people the knowledge and tools to make responsible choices about their sexual health and their lives.
Exactly. Empowering them to take control.
And when we're talking about sexual health, we can't forget about sexually transmitted infections, or STIs. The sources were pretty clear about how prevalent they are and the consequences if they're left untreated.
It's true. It's definitely something we need to be educating our patients about: prevention strategies, the importance of seeking treatment early. It's crucial.
Absolutely.
Yeah.
And it's about making sure those conversations are comfortable for both the patient and the nurse.
Yeah. It's a sensitive topic. So how do we talk about it without making people feel judged or uncomfortable?
Right. Well, the sources stress the importance of clear, direct, compassionate communication, using language that's accurate but easy to understand, and making sure our patients feel safe asking questions and sharing their concerns.
It's not just about conveying information, it's about building trust.
Exactly. We need to be attentive to their verbal and nonverbal cues, and also be mindful of our own biases and make sure we're not unintentionally creating barriers.
That's so important. It's about active listening, asking open-ended questions, and tailoring the information to each patient's unique needs.
And sometimes it's also about knowing when to refer a patient to a specialist.
Right. We don't have to know everything. If a patient needs more specialized care for something like sexual dysfunction, we can connect them with the right resources.
Absolutely. It's all about advocating for our patients and making sure they get the best possible care.
Couldn't agree more. Advocacy is a huge part of our role. And speaking of advocating for patients, I think something that really resonated with me in the sources was the emphasis on nurses being comfortable with their own sexuality.
I agree. That's so important.
Right. Like, how can we provide unbiased and effective care if we're not comfortable with our own sexual identity and values?
It's not about sharing our personal experiences with patients. It's more about self-awareness and making sure our own biases don't get in the way of providing compassionate and respectful care.
Exactly. Everyone deserves to be treated with dignity and respect no matter what.
Absolutely.
Yeah.
Now, I want to shift gears a bit and talk about the female reproductive system and some of the common issues that women can face. The sources really went in depth about menstruation and the challenges that can come with it.
Right. Like how irregularities in the menstrual cycle can be caused by so many different things: pregnancy, breastfeeding, eating disorders, extreme weight loss, excessive exercise conditions like polycystic ovary syndrome or PCOS.
It's complex. And it's not just the physical side of things that we need to consider. Cultural beliefs and societal expectations can also have a huge impact on a woman's experience of menstruation.
Yeah. The sources even talked about how in some cultures menstruation is still seen as taboo or shameful.
It's hard to believe, but it's true.
And that can prevent women from getting the care and support they need. It's important for us as nurses to be aware of these cultural influences and create an environment where women feel comfortable talking about their menstrual health.
We need to break down those harmful stereotypes and provide accurate information and support.
Definitely. And when we talk about menstruation, we also need to address premenstrual syndrome, or PMS, and premenstrual dysphoric disorder, or PMDD.
Right. These conditions can have a real impact on a woman's quality of life.
PMS is characterized by a whole bunch of emotional and physical symptoms that happen in the days or weeks leading up to menstruation. Things like mood swings, irritability, anxiety, breast tenderness, bloating, fatigue.
It's a lot to deal with.
It is. And it's important to remember that PMS is very common. But if the symptoms are severe and really debilitating, it could be PMDD, which is a diagnosable mental health condition.
So how can we as nurses help women manage these conditions?
Well, the sources really emphasize the importance of validating their experiences and listening to their concerns.
Because a lot of women feel dismissed or told their symptoms are all in their head.
Exactly. So we need to provide accurate information, educate them about their options, and connect them with resources and support. This might include lifestyle modifications, stress management techniques, dietary changes, or even medication in some cases.
It's about taking a holistic approach and recognizing that these conditions are real and can significantly impact a woman's well-being. Now I think it's time we dive into the human sexual response cycle.
This is where things get really interesting.
From what I understand, it's not just about the physical act of sex itself, It's a whole physiological and psychological process.
Exactly. The sources described a 4-stage model of the sexual response cycle: excitement, plateau, orgasm, and resolution. Each stage is marked by specific physical and emotional changes.
Okay, so let's break it down. What happens during the excitement phase?
Well, during excitement, there's an increase in heart rate, blood pressure, muscle tension, and blood flow to the genitals. In women, this leads to vaginal lubrication and swelling of the clitoris and labia. And in men, you see penile erection.
Okay, so that's the initial arousal stage. What happens next?
Then comes the plateau phase. This is where things intensify. Arousal continues to build, but at a slower pace. This phase can last for a few minutes or even longer.
And then orgasm.
Yes, orgasm is the peak of sexual pleasure.
Yeah.
It's characterized by involuntary muscle contractions and a sense of release.
And this is experienced differently by men and women.
It can be, but the key takeaway is that orgasm is a subjective experience. It can vary a lot from person to person.
Makes sense. So what about resolution? What happens during that stage?
Resolution is essentially the cool-down phase. The body gradually returns to its pre-aroused state. Heart rate, blood pressure, muscle tension all decrease.
Okay, I think I'm getting this.
Yeah.
But it's important to remember that this 4-stage model is just a simplification, right?
Absolutely. Sexuality is complex and personal. Not everyone experiences these stages in the same way or even in this order.
Right, and there are lots of factors that can influence the sexual response cycle. Things like stress, fatigue, relationship issues, certain medications.
For sure. So why is it so important for nurses to understand this?
That's a good question.
Well, it helps us provide better, more sensitive and informed care to our patients. For example, if a patient is experiencing sexual dysfunction, understanding the different stages of the cycle can help us identify potential factors that might be contributing, and then we can come up with appropriate interventions or referrals.
So it's not just about treating the physical symptoms. We need to understand the whole picture.
Exactly. We need to see the person behind the symptoms.
Yeah.
And we need to remember that sexuality is a normal and important part of human experience.
It's something we should be able to discuss openly and without shame.
Absolutely. Now I think it's time we talk about patient education.
Patient education is essential in every area of nursing.
It really is. And when it comes to sexual health, it's absolutely vital.
Because patients might have a lot of questions and concerns, but they might be too embarrassed or afraid to ask.
Right. So we have to create that safe and supportive environment where they feel comfortable seeking information.
And the sources highlighted some key areas where patient education can make a real difference. Things like helping patients understand their own bodies, the different forms of sexual expression, safe sex practices, contraception, STIs.
We need to give them the knowledge and tools to make informed decisions about their sexual health. And we need to correct any misinformation they might have picked up along the way.
It's about separating fact from fiction.
Exactly. Like, we might need to address common myths about sexuality, like the idea that penis size is directly related to sexual performance.
Or that masturbation is harmful, or that women don't enjoy sex as much as men.
Right. These are all misconceptions that can cause a lot of anxiety and shame and even relationship problems. Our job as nurses is to provide accurate and evidence-based information that's tailored to each individual's age, developmental stage, and cultural background.
Absolutely.
That's great.
We need to be sensitive to those individual differences while also promoting healthcare practices that are ethical and safe.
Finding that balance is key. Now, before we wrap up this part of our deep dive, I want to touch on a topic that can be really challenging for nurses: sexual harassment.
Unfortunately, it's a reality that nurses often face harassment from both patients and colleagues.
And it's never okay.
Never. It's crucial that we know how to recognize harassment, set clear boundaries, and report any incidents.
The sources give some really clear guidelines on how to handle these situations.
It's important to remember that you have the right to feel safe at work.
Absolutely. You don't have to tolerate harassment.
Yeah.
And if you see a colleague being harassed, speak up. We need to support each other.
Absolutely. Now, I know we've covered a lot of ground today, but I want to emphasize that this is just a starting point. Learning about human sexuality is an ongoing journey.
It is. There's always more to learn and discover.
Exactly. It's a fascinating and ever-evolving field.
For sure. And it's crucial to stay up to date on the latest research guidelines and best practices.
Absolutely.
So what are your thoughts so far?
Well, I think this deep dive has been really insightful.
Me too.
I'm especially struck by how the sources emphasize that sexual health is so deeply connected to other aspects of a patient's life.
You're so right. We can't treat sexuality in isolation. It's inherently linked to physical health, mental health, emotional well-being, relationships, cultural beliefs, socioeconomic factors. It's all intertwined.
It's a web.
It is. It's complex. But that's what makes nursing so challenging and rewarding. We get to deal with the whole person, not just one isolated part.
So how do we as nurses navigate this complexity? It seems like a lot to juggle.
It is. But that's where the art of nursing comes in. We use our knowledge, our critical thinking skills, and our empathy to provide truly holistic, patient-centered care.
It's not just about memorizing facts.
No, it's about understanding the whole person, recognizing their unique circumstances, and seeing how sexual health intersects with all these other areas of their life.
Do you have an example of how this might play out in a real nursing situation?
Sure. Let's say you have a patient who's recovering from a heart attack. They might be anxious about resuming sexual activity, worried about putting too much stress on their heart.
That's understandable.
It is. In that situation, our role as nurses would be to acknowledge their fears, provide accurate information, and maybe even consult with the cardiologist to come up with a plan that allows the patient to gradually and safely resume intimacy.
So we're not just giving them a pamphlet. We're having a real conversation, taking their concerns seriously, and working together to find solutions.
Exactly. We're recognizing that their sexual health is a legitimate part of their overall well-being and recovery.
I love that example. It really shows the importance of that holistic, person-centered approach. And now, before we wrap up, I always like to leave our listeners with a question to think about.
A good tradition.
What do you have in mind today?
I was thinking about how we've talked about the importance of nurses feeling comfortable discussing sexuality.
Yes.
But what does that actually look like in practice? How can we as future or current nurses make it easier for our patients to open up about these sensitive topics? What are some practical strategies we can use to create a safe and judgment-free space for these conversations?
That's a great question for all of us to think about.
And remember, the more comfortable we are discussing sexuality, the better we'll be at helping our patients live healthier and more fulfilling lives.
Absolutely. So to all our listeners out there, whether you're a nursing student, a seasoned professional, or just someone who's interested in learning more, keep learning, keep asking questions, and keep striving to provide the best possible care.
Because at the end of the day, it's all about empowering our patients to take control of their sexual health and their lives.
Well said. Thank you so much for joining us on this deep dive into human sexuality.
My pleasure.
Until next time, take care, everyone.
Bye, everyone.
So we were talking about the female reproductive system and, common issues.
Menstruation.
Yeah, those challenges.
Yeah, the challenges.
Definitely.
And the sources really went into detail about how, irregularities in the menstrual cycle, they can be caused by a whole bunch of different factors.
Yeah, like what kinds of things?
Well, pregnancy, breastfeeding, eating disorders, extreme weight loss, excessive exercise.
Oh, wow.
Even conditions like polycystic ovary syndrome or PCOS.
It can really run the gamut.
It can. And it's not just the physical side of things either.
Right.
We got to think about cultural beliefs and societal expectations.
Yeah, absolutely. Because those can have a huge impact on how a woman experiences menstruation.
Totally. The sources even mention how in some cultures menstruation is still taboo.
It's crazy.
It's shameful.
Yeah.
And that can prevent women from seeking care and support.
Oh, for sure. It's important for us as nurses to be aware of those cultural influences and, really try to create an environment where women feel comfortable talking about their menstrual health.
Exactly. We need to break down those harmful stereotypes and just, provide accurate information and support.
Yeah. And when we talk about menstruation, we also have to think about premenstrual syndrome or PMS and premenstrual dysphoric disorder or PMDD.
Yes. Those conditions can have a real impact on a woman's quality of life.
They can. And PMS in particular is characterized by a whole range of emotional and physical symptoms.
Yeah, in the days or weeks leading up to menstruation.
Right. Like what kinds of things are we talking about?
Well, mood swings, irritability, anxiety, breast tenderness, bloating, fatigue.
That's a lot.
It is. It can be really tough. And PMS is, it's very common.
Yeah.
But if those symptoms are severe and really debilitating, it could be PMDD, which is a diagnosable mental health condition.
So how can we as nurses help women manage these conditions?
Well, one of the most important things is just validating their experiences and listening to their concerns.
Right, because so many women feel dismissed or told their symptoms are all in their head.
Exactly. We need to provide accurate information, educate them about their options, connect them with resources and support. And that might include lifestyle modifications, stress management techniques, dietary changes, or even medication in some cases.
This whole multifaceted approach.
It is. It's about taking a holistic approach and recognizing that these conditions are real and they can significantly impact a woman's well-being.
Now I think it's time we talk about the human sexual response cycle.
Yes, this is where things get interesting.
It's not just about the physical act of sex.
No, it's not.
There's a whole physiological and psychological process involved.
Absolutely. The sources described a 4-stage model of the sexual response cycle. You've got excitement, plateau, orgasm, and resolution.
Okay, and each stage has its own unique characteristics.
It does. Each stage is marked by specific physical and emotional changes.
So let's break it down. What happens during the excitement phase?
So during excitement, there's an increase in heart rate, blood pressure, muscle tension, and blood flow to the genitals. In women, this leads to vaginal lubrication and swelling of the clitoris and labia, and in men, you see penile erection.
Okay, so that's the initial arousal stage.
It is.
What happens next?
Next, you have the plateau phase. This is where things really intensify. Arousal continues to build, but at a slower pace.
Okay.
This phase can last for a few minutes or even longer.
And then comes orgasm.
Exactly. Orgasm is the peak of sexual pleasure.
Mm-hmm.
And it's characterized by involuntary muscle contractions and a sense of release.
And I imagine this is experienced differently by men and women.
There can be variations, yeah. But the key takeaway is that orgasm is a subjective experience.
Right. It's different for everyone.
It varies from person to person.
So what about resolution? What happens during that phase?
Resolution is basically the cool-down phase. The body gradually returns to its pre-aroused state. Heart rate, blood pressure, muscle tension all decrease.
So it's like coming back down to earth.
Exactly. It's the body returning to its normal state.
Okay, I think I'm getting this. But it's important to remember that this 4-stage model is just a simplification.
Right.
Sexuality is complex and individual.
It is. Not everyone experiences these stages in the same way or even in the same order.
Right. And there are so many factors that can influence the sexual response cycle.
There are things like stress fatigue, relationship issues, medications.
Right. It's all connected.
It is. So connecting this back to nursing, why do you think it's so important for us to understand this cycle?
It's a good question.
Yeah.
Well, I think it helps us provide more sensitive and informed care to our patients.
Okay. I like that.
For example, if a patient is experiencing sexual dysfunction, understanding those different stages can help us identify potential contributing factors.
Yeah.
And then we can provide appropriate interventions or referrals.
Exactly. It gives us a framework to work with.
It does. And it reminds us that sexuality is a normal and important part of the human experience.
Yes. It's something we should be able to discuss openly and without shame.
Absolutely. Now I think it's time we talk about patient education.
Patient education is so important. It's one of our core responsibilities as nurses.
It is.
Yeah.
And when it comes to sexual health, it's absolutely vital.
It's crucial. Patients often have questions and concerns, but they might be too embarrassed or afraid to ask.
Oh, for sure. So we have to create that safe and supportive environment where they feel comfortable opening up and seeking information.
We do. And the sources highlighted some key areas where patient education can really make a difference.
Like what?
Well, helping patients understand their own bodies.
Okay.
The different forms of sexual expressions, safe sex practices, contraception, STIs.
So much to cover.
There is. It's a
Yeah.
lot. But it's about giving them the knowledge and tools they need to make informed decisions about their sexual health and correcting any misinformation they might have picked up along the way.
Separating fact from fiction.
Exactly. Like, we might need to address common myths about sexuality.
Like what kinds of myths?
Well, like the myth that penis size is directly related to sexual performance.
Right.
Or that masturbation is harmful.
Yeah.
Or that women don't enjoy sex as much as men.
These are harmful myths.
They are. And they can lead to anxiety, shame, and even relationship problems.
Definitely. So our role as nurses is to provide accurate and evidence-based information.
Right. And that information needs to be tailored to each individual's age, developmental stage, and cultural background.
We need to be sensitive to those individual differences.
We do, but at the same time, we also need to promote healthcare practices that are, ethical and align with professional standards.
Finding that balance is key.
It is. And, speaking of sensitive topics, I think it's important to talk about sexual harassment.
Yeah, it's an unfortunate reality that nurses are often targets of harassment.
It is. Both from patients and colleagues.
And it's never okay.
Never. It's crucial that we know how to recognize harassment, set clear boundaries, and report any incidents appropriately.
The sources provided some great guidance on how to handle these situations.
They did. And it's important to remember that you have the right to feel safe in your work environment. If you're being harassed, you don't have to tolerate it.
And if you see a colleague being harassed, speak up.
Yes, we need to support each other.
Absolutely.
Hey,
I know we've covered a lot of ground here,
we have.
but this is just a starting point.
It is. Learning about human sexuality is an ongoing journey. There's always more to discover, and it's so important to, stay updated on the latest research guidelines, best practices.
It really does feel like we've only just scratched the surface today.
We have, but I think this deep dive has given us a lot to think about.
It has. What really stood out to me was how the sources emphasized that sexual health is so interconnected with everything else going on in a patient's life.
Oh, absolutely. You can't treat sexuality in isolation.
Right.
It's linked to physical health, mental health, emotional well-being, relationships, cultural beliefs, socioeconomic factors. It's all connected.
It's like a web.
It is a web. It's complex.
Yeah.
But that's what makes nursing so challenging and so rewarding.
Yeah.
We get to deal with the whole person.
So how do we navigate that complexity as nurses? It seems like a lot to juggle.
It is a lot, but I think that's where the art of nursing comes in. We use our knowledge, our critical thinking skills, and our empathy to provide truly holistic, patient-centered care.
So it's not just about memorizing facts about STIs or, different types of contraception.
No, it's about understanding the whole person, recognizing their unique circumstances, and seeing how sexual health kind of fits into all these other areas of their life.
Do you have an example of what that might look like in a real nursing scenario?
Sure. Let's say you have a patient who's recovering from a heart attack.
Okay.
And they're anxious about resuming sexual activity. They're worried about putting too much stress on their heart.
That's a valid concern.
It is. And in that situation, our role as nurses would be to acknowledge those fears, provide accurate information, maybe even consult with the cardiologist to develop a plan that allows the patient to, gradually and safely resume intimacy.
So we're not just handing them a pamphlet.
No, we're having a real conversation with them, taking their concerns seriously, working together to find solutions.
I love that example.
Yeah.
It really highlights that person-centered approach. And, before we wrap up, I always like to leave our listeners with a thought-provoking question.
A good tradition.
What do you have in mind today?
Well, we've talked a lot about how important it is for nurses to feel comfortable discussing sexuality.
Yes.
But what does that actually look like in practice?
Yeah.
How can we as future or current nurses make it easier for our patients to open up about these sensitive topics?
Right.
What are some practical strategies that we can use to create a safe and judgment-free space for these conversations?
That's a great question for everyone to think about.
It is. And remember, the more comfortable we are discussing sexuality, the better equipped we'll be to help our patients live healthier and more fulfilling lives.
Absolutely. So to all our listeners out there, whether you're a nursing student, a seasoned professional, or just someone who's curious about this topic, keep learning, keep asking questions, and keep striving to provide compassionate and informed care.
Because at the end of the day, it's all about empowering our patients to take control of their sexual health and their lives.
Well said. Thank you so much for joining us on this deep dive into human sexuality.
It was my pleasure.
Until next time, take care, everyone.